Good morning. I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is solutions to difficult breathing. Well, the ability to breathe is basic. If we can't breathe through our nose, God created another aperture to breathe through, our mouth. Often, our significant others complain about our snoring, and snoring can be improved, but not necessarily all the time. So let's talk about breathing, non-surgical and surgical. Probably the most common cause of difficulty breathing is allergies. Well, what do allergies do? These are from the environment, pollens, environmental chemicals. We have a divider on our nose called the septum. That septum separates the left and the right nasal passage. It goes all the way back to the back of our throat. Now, we have a set of 3 turbinates. What are those? They're air conditioners. They are on the outside of our nose, inferior, mid, and superior. They humidify the nose, the air through the nose, so when it gets to our lungs, the air is just not hot and without moisture. But sometimes these turbinates can enlarge. They're covered by mucosa, sort of an internal skin surface. If you get allergies, sometimes those turbinates enlarge, and that's why you get a runny nose or the nose you can't breathe. So the first thing to do is try to use medications over the counter or go to an allergist. Make sure you've tried everything non-surgically. Okay, if that fails, then you need an exam, because if you have a deviated septum, it can be like an S or it can go to one side. The turbinates here breathe out of one nose but not the other. So if we need to repair the deviated septum, what we do is we remove the septum but leave the mucosa lining and bring it back centrally. So now the airflow can be direct. This is sometimes covered by insurances. And you may have a deviated septum and a straight nose, or you may have a crooked nose and a straight septum. The two are sometimes related, but sometimes not. The turbinates, since you have 6 of them, we'll go ahead and not remove completely the lower turbinates where most of the obstruction occurs, but we reduce it so that you can still humidify the air, but the air can pass on through. What's the recovery like? Usually if we just do a septoplasty alone, or in conjunction with a cosmetic rhinoplasty, the recovery is the same. The septoplasty, when we finish, we will have no packing, but it will have 2 tubes. These little tubes will allow you to breathe through them. They also separate and support the septum so it heals in the correct fashion. You won't see them from the outside. Those are usually taken out at the 10-day period. We give you a little irrigating catheter as such. Now, if you're having a cosmetic rhinoplasty, you will have an external splint for approximately 7 days. So, with airway obstruction, there are solutions. Some of them are medical, and some of them are surgical. I suggest you come in for a consult if you would like more information. Thank you, and I look forward to seeing you shortly.